Hello, my name is Dr. Kathleen Van Cleef from Durham University, and I welcome you to this new video in our series on visual perception. In this one, I will tell you a little bit about the different steps that our brain takes in making sense of the world around us. So, imagine that you're standing in front of your fridge and you're looking for some lunch. Your eyes might fall on this little pot on the right. Maybe you're thinking of having some hummus. So, what is happening in your brain when you look at this pot? First of all, the light that is reflected from the pot will fall on the retina of your eye. And your lens will also make sure that the picture is nicely in focus and your eyes are moving together to the right location in the fridge. If a brain injury is affecting this stage of your visual processing, you can have problems with visual acuity, with eye movements, or with visual fields. Next, your eyes will transform the light into electrical signals, and these are sent to the back of your brain. We call this the occipital cortex. And this part of the brain translates the electrical signals in simple object features, like colors, or shapes. So if you have difficulties or if you have an injury in this area of your brain, you will have difficulties with recognizing colors, like color blindness, recognizing shapes, or things like akinetopsia, where you have difficulties with seeing motion. In a second stage, the brain will then combine the different features, so combine, for instance, color and shape together. If you have a difficulty with that, that means you'll have apperceptive agnosia. Next, the signals are then sent along two pathways. There is one at the bottom of your brain. It follows to the temporal cortex, and we call that the ventral stream, or the what pathway, because this one is working out what we're looking at. So if you have a brain injury in this area, you will have difficulties finding out what things are, or find it hard to recognize faces or read letters. The other pathway is the where pathway, or the dorsal stream, and it goes to the parietal cortex. These areas are responsible for attention and for coordinating your actions, so eye-hand coordination, for instance. So if you have an injury along this pathway, you might have difficulties with paying attention to the left or the right side, like in neglect or simultanagnosia. So that was a short overview of the different steps involved in visual processing. If you want to learn more about each of the different conditions I mentioned, check out our other videos. Thank you for watching.